Good afternoon. I'm Geraldine Summers. I'm a nurse practitioner here in the office. You're Samuel Summers?
Yes.
Can I call you Sam?
Yes.
I'm going to be conducting your head-to-toe assessment today. First of all, I need to know if you had emptied your bladder.
Yes, I did.
Okay. And I have washed my hands. We're going to do his height and weight first. So would you hop on the scale? I'm going to head and have you make sure you put your feet against the wall. Don't bend your neck. Okay, go ahead. 5'7", 228. Okay. You're going to have a seat for me. Now during this video, I'm going to make you comfortable. I'm going to ask you, would you like to remove your shirt now, or do you want to do it later?
I'll take it off now.
Okay. You have it, and I'll put it up there for you. Okay. I'm going to be doing your blood pressure. This is a wrist blood pressure. And this is going to automatically take your blood pressure. I just want you to relax your arm on your thigh. Okay. And as that's going on, I'm going to take your temperature in your ear. Oh. And I'll also check your apical pulse. I'm doing your blood pressure. Regular. 129/72 is the blood pressure, which is the normal limit. Okay. All right, next I'm just going to inspect your whole body. What I'm going to do is just start from head to toe. Like I mentioned, I'm going to look, then I'm going to feel, then I'm going to touch, and we call that palpate, and then I may what's called percuss, and it's going to be a little bit pounding on your throughout your systems here.
Okay.
All right. At first, no rashes, lesions noted. Eyes, eyebrows, eyelashes are intact and symmetrical to the face, to his head. Nose is symmetrical and in line to his face. Mouth is symmetrical, no droopingness. No lesions are noted. Ears, both ears are symmetrical to his face and head. No lesions, rashes noted. Okay. I'm going to start using my hand, so I'm going to ask you if there's any pain or pressure, let me know. This is the frontal bone that we're doing. Any pain, pressure?
No.
Okay. We're going to do the temporal area. Pain?
No.
Okay. We're going to go to the parietal with no masses noted, and then we're going to go back to the occipital with no masses noted. We're going to come back to the front, and we're going to go do some sinuses. So we're going to take the frontal. Any pain when I push?
No.
Okay.
No pain.
No tenderness, no swelling noted on the frontal. This is the ethmoid. No pain or tenderness.
No.
Okay. Any of the sphenoid, pain or tenderness there.
No.
And then this is the maxilla. Any pain or tenderness?
No.
Okay. All right, and then we're going to do over some bones. This is the septum to the nose, and that's intact. No pain.
No.
Okay. This is the maxilla bone, and then the mandible bone. Any pain or tenderness there?
No.
Okay. We're going to go to the temporal mandibular joint. No masses noted there. Any pain or tenderness?
No.
Okay. Can you open your mouth? Okay. And close it. Open and close. Any pain or tenderness to your jaw?
No.
Okay. I'm going to ask you to open it and then your lower jaw side to side. Any pain or tenderness?
No.
Gotcha. Okay. Then I'm going to go over some lymph nodes. I'm sorry. I lost my train of thought. I'm checking for your preauricle lymph nodes here. And I'm going to do some rotation on here. This is the posterior auricle lymph nodes. And we're going to do that as in a circular motion. No pain or tenderness noted?
No.
No lymph nodes noted. Okay. Then we're going to go to the tonsillar. Any lymph nodes noted? No pain or tenderness?
No.
Submandibular. submental, and there's no pain
No.
and nothing noted. Okay. Then we're going to go down into your neck, and this is the anterior cervical chain, posterior cervical chain, and we're just trying to see if there are any rotations to that. There is none noted. The supraclavicular, none noted there. Okay. And then you do have a lot of lymph nodes under your arm, so I would like to check them at the time. I'm going to hold your arm. And any pain or tenderness there?
No.
Okay. I'll check the other arm. No pain or tenderness noted?
No.
Nothing palpated? All right. Okay, great job. Okay. Then we're going to ask you to close your eyes, clench your teeth, smile, puff out your cheeks, wrinkle your forehead. Okay. And all of those we're testing for your cranial nerves. Now, cranial nerve 12 was puffing out your cheeks. What I need to do for cranial nerve 12, which is hypoglossal, is I want you to stick your tongue, puff your cheeks out and stick your tongue as I'm putting pressure. Don't resist. That's it. And again on the other side, looking for that. That's cranial nerve 12, hypoglossal. Okay. Cranial nerve 5 also consists of some soft to pain movements. So it's a smooth touch to a sharp. So let me know what you feel. Okay, go ahead and close your eyes. Sharp or smooth?
Smooth. Smooth. Sharp. Sharp.
Okay, that's testing the cranial nerve 5, which is the facial. I'm sorry, to trigeminal. Facial nerve, we're going to go for your hair before we do anything else, and that's smooth and soft, and he still does have pretty good amount of hair. There's a little thinning in the front. Eyebrows, eyelashes are good. I'm going to pull down and look for your... Okay. I'm going to ask you to look up for me and look right to left. We're looking for the sclera, redness, drainage, pain or tenderness. Do you wear contacts?
No.
Okay. And glasses?
No.
Okay. We're checking for the lacrimal apparatus here to see if there's any pressure, or I'm sorry, any tenderness or pain. Any tenderness or pain there?
No.
No swelling noted. No. This is the zygomatic bone, cheekbone, which is no pain or tenderness on here when I touch?
No.
Okay. Okay. Now we're going to go to your eye vision. First of all, I'm going to do what's called the Rosenbaum test, which is the optic nerve 2. And we're going to ask you to read the lowest line possible.
91573 OOX.
Great. That's good. So that's testing for the optic nerve 2. Okay. Then I'm going to test you for the field of vision. This is what's called the 6th cranial field of vision. Sixth cardinal field of vision. I'm going to ask you to follow my finger without moving your head. This is also testing for some cranial nerves. 3 is an oculomotor, 4 is trochlear, and 6 is abducens. Okay? I'm going to start in the middle. Work. Up. Down. Across. Up. And down. In the middle. Any double vision noted?
No.
Okay. Next, I'm going to be shining a light in your eyes, and this is to test for direct and indirect, or consensual. So I'm going to flash the light in your. We'll start with your left eye first, and I'm going to flash the light in there, and then I'm going to look at the pupil response. Then I'm going to also flash it in again, but I'm going to look in the opposite eye for the consensual. Okay, that's good. Now I'm going to do what's called a cover test, which is also for your field of vision. I'm going to cover up. I'm going to have you look at my nose, And I'm going to cover up one eye while I look in the opposite eye. And this is the cover-uncover test. Looking at your pupil responses. Okay. Have you had any drainage from your eyes?
No.
Okay. Any problems with your eyes lately?
No.
No. Right. Next, I'm going to test your hearing. This is for balance in both ears. This is called a tuning fork, and it's going to have some vibration. I'm going to set it on the top of your head. Tell me if you can hear it one side, both sides, or no sides.
Both sides.
Both sides? Okay. Hearing's good. Next one is, and that's the Weber test. The Rhine test, what I'm going to do is we're going to measure your bone air conduction. So I am also going to use the tuning fork. It's going to hit the tuning fork with a sound, and I'm going to put it in the back of your ear on the occipital bone. I want you to let me know when you can't hear it anymore. And then I'm going to move it to the front of your ear and time your time to see the difference that we get.
No. No.
We had 4 seconds on the bone with 9 seconds on the air conduction, which is double air conduction, which is correct. I'm going to do it on this ear and check and see. Make it work. So.
No. No.
Okay, that was 3 seconds there compared to 9 seconds for the air conduction. So that's good. Both equal. All right, next we're going to look in your ears. And what I'm going to be looking for is the umbrum, the handles of malice, and the light reflux. And I'm going to do that. I already inspected the auricle, and there's no masses, lesions, okay, no redness. Any drainage from your ear? Any earaches lately? Okay.
No.
I'm going to pull back and up. And I see the umbrum, the handles of malice, the light reflex, and your tympanic membrane is intact and it's pearly gray. Great job there. And I'm also inspect the other ear. Okay, I'm going to do the same thing. Pull up and back. Look in there. There's no drainage, no masses noted. And the umbrum is intact. Handle of malice. The light reflux is noted. And tympanic membrane is pearly gray. That's good. Okay. Any problems with your ears that you noticed?
No.
Okay.
No problem.
All right, next I'm going to go to your mouth, and we're going to inspect your mouth. First I'm going to flash the flashlight and just look at it normal. Okay. Tongue is a little dull with glossy, as tooted. The floor of the mouth, without masses. I have the hard palate, soft palate noted. The boca mucosa is glistening. Manual has 29 teeth, and 3 of them are with caps noted. Okay. So next I'm going to look farther down. So this is going to be the gag reflex also, and it's cranial nerves 9 and 10. 9 is glossopharyngeal, and 10 is vagus nerves. Okay, so I'm going to have you stick out the tongue and say ah.
Ah.
Okay, I got the uvula, I got the arterial posterior arches, pillars, posterior pharynx is noted. Any problems there?
No.
Okay. I'm going to ask for you to stick out your tongue for me. Pull it up, pull it down, move it to side, any discomfort there.
No.
Okay? I'm going to actually visually hold it so I can see, making sure that there's no masses or lesions under the tongue. Okay? Lift that up. Side to side, lateral, and up. Okay? Nothing noticed. Notice any swallowing difficulties?
No.
There's no
No
redness
problems.
in the back. That's very good. One of the tests for your ears, we're going to test for whisper test. So I need to whisper a word in your ear, and I need to know if you repeat it. So cover one of your ears.
Hot dog.
Okay, go ahead and cover the other.
Hot dog.
Okay, and no problems there. Okay, good. Next thing I'm going to do is I'm going to go to the cranial nerve 11, which is the spinal accessory, and that's going to be shrugging your shoulders. And I'm going to put some resistance, so try not to resist. That's testing this sternocleidomastoid and the trapezius muscles. Okay. I'm going to also have you look now at your neck, just inspecting it for any masses, lesions, redness, swelling. Nothing's noted. No jugular vein distension, and I'm looking both sides equally. No massive palpations. Now I'm going to feel the trachea, which is midline. No rashes. All right. And I'm going to feel. I'm going to come behind you and feel for your thyroid. Just making sure there's no lesions or masses noted. Okay, and I'm going to ask you to swallow. Okay, not movable. Very good. Okay. Then I'm going to check your carotids. I'm going to do one at a side. These are your carotids. Just checking to make sure that circulation is good. Okay. And then the next step for that is I'm going to listen to those. Take a deep breath in and hold it. Okay, let it out. Okay. Deep breath in and hold it. And let it out. Okay? And then your thyroid. Take a deep breath in and hold it. Okay, great job. Okay. All right. Before I go any further with that, I'm going to check your nose. I want to check your mucosa of your nose, your septum, and your turbinates, making sure there's no redness, drainage, swelling. Any pain or pressure in your nose?
No.
Okay. Turbinates good. No swelling. No sinus drainage noted. Okay, I'm going to have you close one of your sinuses off, or your nasal cavity off, and then kind of breathe. Any difficulty breathing?
No.
Okay, go ahead and do the other side. And no problems there.
No.
Okay, great. All right, next I'm going to go to the back. I want to listen to your lungs. I'm going to check for diaphragmatic excursion. So that needs to be marked. So when I do, can I use tape or a marker?
Marker's fine.
Okay. And then I'm going to be feeling and palpating also. Okay. First, I'm going to look first. Lesions or rashes. Well, he does have an old scar. And he does have some acne from previous acne scars from his teenage years. Okay. But nothing that's severely red. Nothing that I feel. No pain or tenderness?
No.
Right. Then I'm going to go for the thoracic excursion. I'm going to be putting my hands on the 10th rib. I'm going to be closing my hands together, spreading my fingers, but my thumbs are connected, and I feel the 10th rib. So I'm going to have you take a deep breath in and let it out. And what I'm looking for is the symmetry of the lung expansions, in and out. All right, that's normal. Good. Okay. Then I'm going to be percussing, and I'm going to do what's called the costovertebral on your kidney area. So let me know if there's any pain or pressure. Pain or pressure?
No.
Okay. Okay. All right. Next, I'm going to do the diaphragmatic excursion. So this is where the measuring comes into play, and this is just showing me the area of your lung expansion. What I'm going to have you do is take a deep breath in and hold it. Okay. And I'm going to mark. And then take a deep breath. And then what I want you to do is let it out. Just let it out for me. Okay. And then I'm going to mark it again. And then we're going to measure. And it must be between 3 and 5 centimeters. Okay. Looks like it's about 4.5 centimeters. Great. Okay. Then I'm going to take a listen to your lungs. And I'm listening for just making sure there's no wheezing or wails or bronchi. I want you to take a deep breath in. And again. Okay. Good. Then I'm going to ask you, I'm going to put my hands on your back, and I'm going to ask you to say 99. And this is to make sure that you don't have any excess air in the lungs. So go ahead and say 99.
99.
99.
99.
Good. No. Okay. Oh, then we're going to come around to the front. And we're going to look at your chest again, making sure there's no, the symmetry is good. Respirations are even. Chest is not zero. It's good. Good shape. Okay. Gonna just do a little palpation. No pain.
Cool.
Okay. Okay. Symmetry. All right. Then I'm going to check for I'm going to check your carotid against your apical pulse. So I'm going to have you turn your head, and I'm going to feel for your apical and in your carotid. Checking your pulses there. And while I'm at your arm, I'm going to check your brachial. Okay. Then I'm going to check the point of maximal impulse. And what I'm going to do is put my hand here and ask you to turn your head to the left as I'm checking your pulse again, your carotids. Then I'm going to check for precordium thrills, pulsations. I'm going to go here first. I'm just making sure there's none of those. Move my hand to the middle. And any difficulty breathing?
No.
Good. Nothing there. Okay. Then I'm going to listen to your heart. Well, let's finish your lungs first. I'll start with your lungs, and then I'll listen to your heart. And out. going to ask you to raise both arms up to your head, and I'm going to check the sides of your lungs. Great. Okay, go ahead and relax your arms. All right, then I'm going to listen to your heart. And I'll start in the aortic area. This is the pulmonic area. Okay. And we're looking at the Erbs area. Okay. And the tricuspid area. And the mitral area. Okay. No chest pain, shoulder pain, jaw pain.
No.
Okay. Okay. I'm going to be checking your arms, making sure the temperature, I can feel in front, nice, warm, dry, no lesions, rashes noted. No palpitations, there's no masses noted. Okay. Nail beds are smooth, pink. Okay, I'm going to have you put your fingers together. And that's we're testing for any lung difficulties, and that's not yet. Okay, I'm going to ask you to grab my hand and squeeze. This is the upper body test, muscle, equal on both sides. Great test. All right. Next thing I'm going to do is I'm going to go back up and move your head, and I'm going to ask you to push resistance. And this is testing also cranial nerve 11. Okay. Okay. We've already did the sternocleidomastoid and the trapeze, and that's kind of involved in that too, for the accessory, spinal accessory cranial nerve. All right, I'm going to ask you to stand up for me. Okay. And I just want to inspect your back, and this is what we're looking for, is more your spine area, making sure your spine is not, it's in symmetry, it's in the midline. I feel no masses going down. No pain or tenderness as I'm palpating?
No.
Okay. Okay. I'm going to ask you to bend over, touch your toes. And I'm also looking for the same thing, making sure the spine stays symmetrical, which it does. And no pain or tenderness?
No.
Okay. All right. Go ahead and sit forward, and then go ahead and lay back down on the chair. And lay all the way back. I'm going to listen to your belly. Look at your belly, listen to your belly. I'm going to put this by your head. I'm going to be measuring your liver expansion. Okay. So I'm checking. And it's a little concave. And it's nothing all around it. Umbilical area is midline. Looks good. Okay. Can I have you take a deep breath in? And hold it. And I'm checking for pulsation. All right. Okay. And then now I'm going to listen. You have 4 quadrants to your abdominal area, and I'm going to listen to each 4. Okay, good bowel sounds. No pain. No pain.
No.
Okay. And you're moving your bowels regularly on a
Yes.
daily basis? Okay. Now I'm going to just do a light palpitation. Any pain or tenderness as I'm palpating?
No.
Okay. Thought. No masses noted. Okay. Now I'm going to do a deeper one, and I'm going to use my 2 hands. Go deeper. No pain or tenderness there.
No.
And no masses noted. Now I'm going to listen to your arteries. And we're going to start with the aortic. And we're going to go to the renal. And then you have your iliac. strong pulses. Okay, they're not weak. All right, next thing I know is I'm going to do a liver expansion. So I'm going to ask you to take a nice deep breath in and hold it. We're going down the midclavicular and the mid-sternal line. Okay, and I'm going to mark it also again. Take a deep breath. That's it. Okay, and breathe. Just breathe. Okay, I'm going to go start from your umbilical area and then work back up, and then it's going to give us the liver expansion. Okay? And I'm going to mark it again. Okay. And I'm going to measure. About 5 and almost 5.5 centimeters. Great. Okay. Now I'm going to feel for the postural margin of your liver in the right. Okay, so I'm going to palpate deeply. No pain or tenderness.
Nothing.
No masses noted. I'm going to go over to the spleen area and do the same thing. Feel the postural margin. Spleen area, no pain or tenderness.
No.
Okay. And I'm going to go to your kidneys, and I'm going to do the same thing in your kidneys. You can't palpate the spleen or the kidneys, but if we did, we'd sure mention it. Okay. And no pain there either?
No.
Okay. Good job. And the next I'm going to do is check for your pulse. I'm going to have you take a deep breath again and hold it. And this is checking for your apical pulse in the belly. So you do have a pulse sensation area there. All right, great. All right, and I ask you to sit up. I'm going to help you up. Oh, so I'm going to check your feet out and your legs out. Any problems with your hips, your legs?
No.
Okay. All right. Feel for muscles. No masses. Warm and dry. Hair on the legs are even and symmetrical. Okay. We're going to check your dorsalis pedis. Good and strong. This is your posterior tibial. Okay. And this is the popliteal. Any pain down the legs, problems there?
No.
All right, we're going to do the same thing over here. Dorsalis pedis. Posterior. And popliteal. Okay, good. All right, I'm going to ask you to put your feet and use it as like a gas pedal and push your strength for your strengthening of your legs. Great. That tests some of the muscles. All right, next we're going to be doing what's called the reflex test, and I'm going to use my reflex hammer, and I'm using it on your Achilles tendon, and on your knee, and on your brachial artery. Okay. Go to the other leg. All right. I'm going to use your knee. I'm going to go to the brachial. All right, and we'll go to the other one. All right, great. All right, then I'm going to finish up our little video here. Do you have any questions or concerns?
No, I don't have any questions.
Okay, thank you. Thank you for being my participant.